Does the lumbar spine contain certain nerves that can cause pain around the hip area when they get compressed?
And certainly it does, and there's quite a bit of overlap between back pain and hip pain, and quite a number of people have been diagnosed with symptomatic hip arthritis, where actually the pain is coming from the back, and vice versa. So it's really important to anybody who has pain in the groin, in the hip area, that both the low back and the hip be properly evaluated.
Yeah, and I noticed there on the right side, the discs that are in red are the osteoarthritic spine. What is it about, why does the disc get flattened over time?
So discs are really majority water, and a newborn has tremendously well hydrated discs. And then really early on in life, the discs start to lose a little bit of their water content. Unfortunately, discs of adults don't have any blood flow, and so they can't regenerate. And as they start to lose water, they'll flatten out a little bit. And as they flatten out, they will bulge. And so that's really what the prime cause of disc bulging is. Now, normally, 80% of the load in the spine is borne by the disc itself. But as the disc degenerates, it starts to place more and more stress on those facet joints in the back, as we're shown in the video. And the more stress that's on those joints, the more likely they are to degenerate, the more likely they are to become pain generators, and then the more likely someone will come in with back pain related to degeneration.
So you mentioned the facet joints get damaged as well?
They do. The facet joints become overloaded, and because they're normally bearing a small minority of the load for the low back, as they're subjected to greater and greater stresses over time, they'll develop arthritis just like any other joint in the body, like a hip, a knee, a shoulder.